Hello, my name is Brent Baum, and I'd like to take a few minutes to share with you 7 exciting breakthroughs that assist us in boosting our immune systems and in resolving memory-based pain and pathology in the body-mind. While each of these breakthroughs in and of itself is significant, in combination they revolutionize the psychopathology model and give us the capacity at times to address the origins of memory-based pain and illness in the body-mind. I'd like to initially walk you through the 7 stages as an overview, beginning with the when. We discovered that with T-1, the millisecond prior to overwhelm, we now have the capacity to identify the precise moment when a single event, trauma, is encoded in the brain waves and physiology of the body-mind. The second breakthrough is the how. We discovered that all memories in the body-mind are stored in a hologram-like manner, which Carl Pergram actually termed holonomic memory. The third and fourth breakthroughs relate to the fact that we encode memory both in the body and in the meridians, discovering that with somatic psychology we have over 1,000 neurons per square inch and can store memory in any part of the body. With energy psychology, we realize that even if we lose a limb, an organ, or the fact that the majority of the cells of our body are new every 7 years, we know at times memory remains, and if we hold a fragment of a memory and another part of an energy system or part of a hologram, that part has the capacity to represent the pathology even if that part of the body is new or has regenerated itself. A fifth breakthrough came with the discovery that there is a way of communicating to the body-mind via color, the infinite language of color, or an experience, the frequencies that were missing at a traumatic moment of encoding. A sixth breakthrough gives us the capacity to enhance holonomic or sensory access to memory, even for those that normally can't visualize or be hypnotized. And the seventh breakthrough actually gives us the capacity to allow the body-mind to teach us and to guide us through patterns of illness and complex PTSD and pathology, which often brings us to the point of illness and pain. There is no longer any doubt that the single greatest factor contributing to the sabotage of our dreams and goals, of our relationships, of our immunity, and our health is the fact that we check out, or as we call it, trance, 15 to 50 times an hour. We leave present time awareness, and as we now know from SPECT scanners, single photon emission computed tomography scanners, when a memory is intact, we go back into the same state of physiological tension and the same brainwave patterns as the original event. As a result of that, we developed a number of techniques targeting this particular moment of encoding in order to take us out of the past and return us to present time awareness. I refer to this as a kind of mindfulness about memory. Among the 7 breakthroughs that we'll be reviewing, the first is the fact that we've now identified the precise moment of trauma encoding, a term that we refer to as T-1, trauma minus a millisecond. A psychotherapist from New Zealand named David Grove, who by the way was also of Maori descent and believed in empowering people to heal from within, identified the term T-1. He also developed a focusing technique that allowed us to identify the particular feeling moment when the body-mind is overwhelmed and takes this picture. He described it always as the millisecond prior to overwhelm, so all of these moments that we encode are in fact protective acts. Reminds me of the old VCRs when we hit stop, got popcorn, came back, hit play, and it backed up a few frames. We always back up 1 frame, 1 millisecond. But that moment of state-bound or state-dependent memory is very powerful and captures our physiology, our emotions, our pain, and consciousness itself. This enabled us to target the specific moment when consciousness is paused. The second breakthrough we refer to as holonomic memory. Our neurophysiologist identified for us the fact that consciousness functions in a hologram-like manner. Carl Pribram, the neurophysiologist who died a few years ago at the age of 95, used the term holographic originally and said that all of our senses and memories function in a hologram-like manner. He realized, however, that in a true holographic system, every fragment contains the whole. And if that were true, then the migraine would be distributed equally throughout the body, which would be extremely unpleasant. Realizing that memory and the physiology of the body is more site-specific, he coined the term holonomic memory, meaning following the laws of a hologram, the rule or law, the nomos, of holographic perception. He stated then that all of our senses function in this type of a hologram-like manner. This means that at a moment of overwhelm, the body can use the holographic principle and take an entire event and reduce it to a single fragment or icon of memory. So the entire traumatic scene can be stored as a lump in the throat, a knot in the stomach, a vice on the head, a knife in the heart, weight on the shoulders. So the body can take this entire experience and reduce it to a single holonomic fragment. However, we also discovered that from somatic psychology, our third breakthrough, that the body possesses 1,000 neurons per square inch, which means that memory is not stored only in the brain. In fact, with certain head injuries, we don't seem to hold the memory. As Bessel van der Kolk's newest book, however, describes for us, the body always keeps the score. The body always remembers, which means that at a traumatic moment, we can take an entire traumatic experience and reduce it to a set of neurons in the body. Breakthroughs in somatic psychology have revealed that we possess over 1,000 neurons per square inch, which means that memory can be stored anywhere in the system when we're slapped in the face, when we are unable to express ourselves and have a lump in our throat, when we're frightened or anxious in our stomach with butterflies or tightness in our chest. There's not a part of the body that cannot store memory. By focusing on these holonomic fragments in the neurons of the body, we have found a way to access, identify, and address these moments of encoding. But we also learned from our vets and from phantom pain that even if we lose the arm or the limb, often the memory remains intact. So somatic psychology, body psychology, was not sufficient to explain the phenomenon we needed to address. Our fourth breakthrough, therefore, is energy psychology, because we now know that at a moment of overwhelm, the body can store the particular pain or tightness or tension in a particular area of the body, in the meridians of the body, and even though we have a new body every 7-year cycle, and the cells have regenerated, somehow this memory can remain intact. We needed, therefore, a language that would address both the somatic, physical body and the emotional body. In 1991, I had a client come to me with chronic left flank kidney pain. She was diagnosed at Johns Hopkins with loin pain hematuria syndrome. After 4 surgeries and attempts to alleviate the pain remained intact. In a 5th desperate surgery, they went to the dorsal channel of the spine and performed a dorsal rhizotomy, severing the nerves to the left kidney region of her body. The problem was, of course, that in 3.5 months, the same pain cycle as usual, the pain returned completely. She flew back to Johns Hopkins and they basically did some tests and identified that the whole left kidney region of her body was in fact numb. She returned to me and explained the situation after the 5th surgery, after which we did a session with the techniques I'm sharing with you called holographic memory resolution, at which point we established safety, and 2 nights later she called me with a flashback identifying that the pain in her left kidney was from sexual abuse at a very young age from a family member, and that the pain returned only with the flashback. The difficulty, of course, is that the pain was in the body of her 5-year-old self, and in that portion of her body, the cells had regenerated several 7-year cycles ago. By addressing the pain in the body at the moment of encoding, at the moment of consciousness, we were able to effectively address and resolve that pain. I sought, therefore, in the early 90s, a language that would address both the physical body and the emotional or energy body. And here we come to the 5th breakthrough, color psychology. One of the things we've learned is that you, with your 7-color projection system, so to speak, are much more sophisticated than our 4-color big screen TV. And you're also a hologram-like projector. Color, in fact, is an infinite language. And outside the womb, it's our first language as a child for emotional communication. The color of mommy's eyes, the color of her face, the shape of her face, her hair, often imprint as our earliest images and messages about self-worth. In 1984, I did a research project with NASA. In my history, I also did archaeology in Israel over a 13-year period of time, mostly in the summers. In 1984, we were developing a research project to fly thermal scanners over the soil of Israel to locate archaeological remains, because man-made objects, man-made materials have a particular spectral signature. I realized during that research that we, with our 7 nerve centers, 7-color projection system, are creating at each moment a very unique picture. What we discovered, therefore, for instance, in art therapy with children, is that if you have a child draw a picture of physical or sexual abuse, they'll nearly always go to red and black. Black meaning no love, no light, no safety. Red meaning minimal, anger, violence. Now black can be calm, elegant, absolute. Red can be power, passion, and energy, positive or negative. But when drawn to depict trauma, the child is saying, I have no love, no light, no safety, black, minimal, anger, violence. If in art therapy you have them redraw the picture, correct the image with the colors and feelings that should have been there, they'll draw the picture with mom and dad present, or protection, or no car accident, and they'll go to their bright, nurturing colors. If you, and you can do this with your own children, if you have them close their eyes and then move the internal color in their mind, a color or feeling, an icon from the safe scene, and have them breathe that through the part of the body holding the original icon of tension, they calm down immediately. The reason being, in physics, if you take red and black and add all of the missing colors, what we create, in fact, is white light. This, we found, neutralizes the static charge of the original stored memory, returning the flow of energy in the meridians to white light and neutralizing the attachment to the event or the memory. Color is very effective. The colors you see for your memories are not my colors and are unique to your perception, which is why we become our own internal healers, and that certain percentages of our memories require our own personal signature to get complete closure. A 6th breakthrough occurred when we identified the fact that we needed to enhance safety. And while I mentioned that color is very effective, the colors from your safe scene are unique to your perception. In fact, I encourage you to create a safe scene of your own and identify the primary color. Breathe that color through your body 50 times, because we've discovered that that's how children imprint in the subconscious. Our conscious mind, by the way, is 5%. Our subconscious mind is 95%. But it is very creative, and it will accept reprogramming through emotional signals like color. In fact, color, we now believe, speaks to both hemispheres of the brain, and is why we imprint our earliest messages about self-worth through the color of mommy's eyes, the color of her hair, which in object relations theory we call mirroring in psychology. 50 times, and we imprint in the subconscious. So while the color of safety moved through the body can establish a primary baseline of safety, we discovered that for severe and complex trauma, additional safety was needed. In 1994, while I was working with a client, I identified the fact that she had fallen and received a concussion on ice and was having migraines. When she reframed this particular memory, the pain discharged from the site in the back of her head and neck and released. I had taken some healing touch training, and also my mother was a bit of an empath and could feel when we were in car accidents and injuries. I discovered that I had a certain level of empathy in working with my clients, and if the memory was still intact, in fact, I could often feel the pain release. Scientists a decade later, after I discovered this ability, this empathic ability, confirmed that the brain does not know the difference between the original and the memory of the event. In 1994, I had my hand placed on or near the back of her head when she released the migraine, but as I scanned downward, I noticed a second pain near C7, and we could not identify a specific memory associated with that pain. In 1994, as the trauma program director at Cottonwood Treatment Center, I proceeded to scan all of the patients that were sent to me. I noticed that they all had the same pain at C7. Now, C7 is the maternal nurturing point where a mother places her hand on an infant's neck and spine to support and create safety. It's also where animals frequently pick up their young in order to bring them to safety in a crisis or in danger. There's something primal about that C7 point. In Chinese acupuncture, they refer to it as the hammer point. And when people were moving into extreme distress during flashbacks, I began to place my hand on that C7 point and found that frequently they calmed down, that their respiration decreased, and eye movement increased. It looked a lot like rapid eye movement, but to experience REM, you must be asleep. In the year 2000, we measured for the first time the effect of placing one hand on the C7 point and discovered that when we do that for our friends and loved ones when they're upset, if you look around and look at their eyes, when you place your hand on C7, you'll often see the eyelids flickering. We discovered that when we enhance safety and ground the body at a point near C7, it creates an alpha-theta brainwave state. And there's a lot of research on alpha-theta. Alpha means that we're relaxing and becoming the observer. Theta means that we're moving into dream or visual access to memory, which means that we can remain calm while accessing the visual and emotional content of memory at the same time. When I first placed my hand on C7 in 1994, the technique became 5 to 10 times faster. People that couldn't normally visualize could suddenly visualize. Those that couldn't be hypnotized could suddenly access the trance without any type of major induction. As a result of that, it allowed us to enhance safety, the number one prerequisite for effective PTSD or memory work. The final breakthrough occurred when we combined these different factors, allowing a focusing technique, targeting T-1, using color for emotional reframing, and discovered that the body possesses an amazing wisdom to map the history of illness or pathology. The seventh breakthrough I refer to as memory mapping. In 1996, a cancer patient was sent to me that was exposed to an environmental toxin from playing near a waste dump. The toxins had produced a virus which expanded to various organs in her system. When I came across her, however, she went into a variety of memories, and when I placed my hand over the primary tumor site, the pain actually left the tumor site, went to her right leg, and she accessed a memory about her father, about when she became ill, her leg became infected. The T-1 or feeling moment, however, was when she stated, "I feel so sad because it's only when I got a high fever, 105, only when I got sick, that I remember my daddy holding me." The message being, unless we get sick, we don't get love. When we emotionally reframed that memory, which is how I refer to my work as an emotional reframing technique, she visualized her dad being more affectionate with her sooner in her life, identified light blue, pink, silver colors, moved her brainwave frequencies through her body, and the pain left her left leg. It returned to the sternum, to the primary tumor site, and began to migrate to the left side of her body. And it was a memory about her mother, in her gut or stomach area. She was 9 years old, got a high fever. Mother comes home from work and finds her ill, has to put her on a bus and take her to another hospital for emergency medical care. The T-1 moment, I feel so guilty about inconveniencing Mama when she's so tired. So on the right side of her body, unless we get sick, we don't get nurtured or loved. And on the left side, it will cause guilt and inconvenience those we love. The shocking factor was the point that every time I worked on her, she was completely pain-free for 2 or 3 days, and if I did not, she was on a morphine pump for the environmental toxins and for the pain in her body, and required that every few hours. I wished I had had the opportunity to work on her, but began to realize that with other conditions like migraines, panic attacks, chronic pain conditions, the body often revealed a sequence or a series of memories revealing the etiology or source of the illness or the disease. When Dr. Mariko Tanaka at San Francisco State saw me do the technique, she said, "I think you found the somatic or body component that Milton Erickson and David Cheek always spoke of, that the body had its own method for spontaneously mapping and revealing the history of a pathology or an illness." With the access of traumatic or stress memories, not just traditional trauma, but even stress in the body-mind, we discovered can create such a trance state. We have an invitation to greatly boost our immune systems by resolving the memories that we still have encoded in the body-mind. My hope is that you will take the insights gained from these breakthroughs and use these kinds of techniques to reframe your own memories, even on a daily basis. I've trained over 150 naturopathic physicians over the years. Dr. Andrew Weil used to refer his medical residents from the Integrative Wellness Program at the University of Arizona to observe my work, and then after I was invited to Miraval upon leaving Cottonwood, he oversaw the Integrative Wellness Program at Miraval as well for a period of time. We believe, as the naturopaths do, that were we to reframe and resolve all of these red, black icons of stress, anxiety, tension in the body-mind, we could greatly boost our immune systems. I believe that the single greatest scandal of the past century is the fact that when we take an effective history, most individuals that have anxiety, and particularly depression, we find a great many unresolved T-1 moments that explain fully why the client has depression. But without effectively addressing such moments of trauma and overwhelm, we're destined to replay and relive these triggers in the body daily. Any fragment of a hologram can access the entire memory. And so you and I often spend a lot of time in the past, reliving the past, and not benefiting from present time awareness. I invite you to take these breakthroughs and on your own do whatever emotional reframing you can to boost your own immune system. Feel free to visit my website, healingdimensions.com. Also, the research portion of our work is at michaelsgift.org and can also be accessed through Amazon Smiles. And as well, miravalresorts.com, where I do a portion of my practice here in Tucson. Thank you for your time and attention.